Good afternoon and welcome to Across the Fence. I'm Jolie Whitney. April is Autism Awareness Month. The DSM, or Diagnostic and Statistical Manual of Mental Disorders, defines autism as a neurodevelopmental condition characterized by persistent deficits in social communication, social interaction across multiple contexts. But that's by going by the book. Autism, as we'll discuss, is a spectrum and a scale between two opposite points. So to talk about autism and hopefully raise some awareness today, I'm joined by Jeremiah Dickerson. He's an assistant professor of psychiatry at the University of Vermont Larner College of Medicine and director of the Vermont Center for Children, Youth, and Family Autism Assessment Clinic. Welcome.
Hi, thanks for having me.
We're happy to have you. And first, just walk our viewers through what happens when a child comes into the clinic.
Yeah, so as you said, autism is a spectrum, and I would add that the spectrum isn't necessarily linear in some ways, that there's lots of different sort of points on the spectrum that folks may fall. And you know, people can present with autism in a lot of different ways. No two people who are autistic look similar. And one person with autism may look different day to day, right, depending on different contexts, different variables. So our team really tries hard to kind of do a really thorough interview with kids and their families. We use some observational tools that allow us some really helpful information to get a sense of yes or no in terms of an autism diagnosis, but we really try hard to kind of dig into a child's lived experience as well. It gives us a lot of information, not only about diagnosis per se, but also about other things that may be presenting alongside autism or look a lot like autism.
All right, so like you said, definitely not a yes or no answer.
Definitely not a yes or no answer. Certainly we see kids whose pediatricians have really high suspicion of autism, and we sort of serve to confirm that diagnosis. But we also see a lot of children, teenagers, even young adults who struggle with anxiety, mood disorders, attention problems, learning difficulties, and all of that can make diagnosis a little bit more complicated and muddy.
Sure, and it's Autism Awareness Month now, so why is awareness so important?
Yeah, awareness is important because I guess there's a handful of reasons. One, awareness can cultivate sort of understanding and promote acceptance and inclusion. Awareness helps to destigmatize. I think it also helps to provide space for and empower autistic individuals to play a larger role in the conversation about autism. Awareness of early signs of autism is important because we know that the earlier that we're able to kind of provide intervention, the better the outcomes might be. Awareness can also, especially in older children, teenagers, and adults, kind of promote self-acceptance in a way that can really be helpful in terms of cultivating self-esteem, a positive sense of self-worth, and allow people to really be effective advocates for themselves and for their family members as well. I also think awareness is quite nuanced in a way as well. So again, autism can present really differently across the lifespan. So thinking about awareness of how autism is related to gender, sort of cultural background, racial background is really important. Paying attention to our own sort of biases and stereotypes and being aware of that is also important as well.
All right, we're going to talk about intervention and some of those signs in a minute, but
Sure.
How common is autism?
Oh boy, so this has been in the news lately, right? A recent CDC report indicated that 1 in 31 children are getting diagnosed with autism by their 8th birthday. And we think that there's a lot of different sort of variables behind that. Awareness is one of them, right? The more aware people are of this, the better folks can have access to sort of screening and diagnostic teams, particularly non-white children. So one of the elements of the CDC report was that Black children and Hispanic children are getting diagnosed more as autistic compared to white children. So awareness on certain populations, I think, has been really important as well.
And do we know what causes autism?
We don't know what causes autism. We know that there's probably not, let me back up. There is not a singular cause of autism. There are a couple of things that science tells us with a lot of certainty. Number one, vaccines do not cause autism. And relatedly, there's not one sort of singular environmental sort of toxin or contaminant that causes autism. Parenting does not cause autism. We do know that autism is probably informed by a lot of genetics, right? So autism runs in families. The science behind that is really complicated. So there's not one autism gene per se. And there's a lot of, probably hundreds, if not thousands of variables that play a role in the development of autism and the development of a differently wired brain.
And is there a lot of science behind the symptoms of autism?
We know that, again, kids, teenagers, adults who are autistic can present really, really differently. And our sort of conceptualization of autism from sort of a medical perspective has really shifted over the past handful of years, particularly with girls. We know that young girls can present differently as autistic compared to boys. And so a lot of these girls may be missed in terms of a diagnosis in early childhood, or misdiagnosed as having something else.
And one of the signs of autism is if somebody doesn't maybe understand social cues or anything like that.
Yeah.
So somebody who doesn't really like to chit chat, is that a sign
Yeah.
of autism, or it could be a myriad of other things?
It could be a myriad of other things. So not picking up on social cues is sort of just one characteristic in a constellation of characteristics of autism. Not just sort of impairments or deficits, but also thinking about strengths as well is really important when we talk about autism. So not picking up on social cues can be sort of an indicator that somebody is autistic or on the spectrum. But there could be a lot of other reasons for that, right? Somebody could be shy, it could be a part of their temperament, they could be really anxious. So our job is to help sort of tease that out and look at all the other things that could also be occurring at the same time.
And you talked about the importance of early intervention, especially when it comes to kind of helping that family out. What do those interventions look like?
They can look really different from family to family, depending on a certain family's needs and also depending on a child's strengths as well, right? For instance, it can look like school-based accommodations, like classroom sort of supports. It can look like behavioral supports, that if there's impairing unsafe behaviors, it can look like professionals like speech and language pathologists or physical therapists, occupational therapists, sort of focusing on different areas of development and promoting that development in a healthy way. And providing tools to allow a child to perhaps be access their environment in a much more easier way.
Sure. And so if a family gets a diagnosis, what comes next?
Yeah. Again, it can be really, really variable.
Sure.
It depends on a child's age. It depends on their certain profile. Kids can be really different, right? So one kid who's autistic may be minimally verbal, but have a really remarkable intellectual profile, let's say, and may have a different way of communicating than through their language, through their expressive language. So they might need tools to help them kind of access that language in a way that's accessible. Other children may be really talkative, but have trouble connecting with their peers in a fluid and dynamic way. And so they may need a little bit more support to kind of do that.
And these interventions, obviously, they work. People with autism live very normal lives, right?
Yeah. I mean, again, the spectrum is quite broad, right? And certainly there are people on the spectrum who are really struggling and are really impaired, but there are also a lot of autistic individuals who are thriving and flourishing. And we can learn a lot just about sort of neurodiversity and the celebration of diversity through autism as well.
And we're going to talk about some more common misconceptions in a minute, but there's been some talk more nationally about a cure to autism.
Yeah.
Talk about that.
Yeah, so in my mind, cure equates with having a disease, and autism is not a disease. I think this conversation is more reflective of sort of our broader ableist culture. Like, autism is not inherently bad, and I think talking about a cure kind of indicates that. I think where the conversation should be going is really paying attention to promoting inclusion, really helping folks who are autistic to feel accepted, feel like they're a part of a broader community. How are we helping to improve their quality of life? I think that's where the conversation should be, and that's where the funding dollars should also be going, frankly.
Sure. And what does inclusion look like, even if you just know someone from school or something like that?
Yeah, I think inclusion looks like, again, sort of like paying attention to your own sort of biases and stereotypes as it relates to autism, and just realizing that we're all human at the end of the day, and that's really important because a lot of people want to feel connectedness. They want to feel like they belong to a larger group, to a community.
Sure. And if somebody is looking to access some of those resources that we've talked about a little bit, where would they go for that?
Yeah, I think, the internet, with more awareness, there's lots more sort of space on the internet that's devoted to autism. Some of that's really great and can be really helpful and is very much evidence-based. Other sort of information on the internet, I think, as we all know, is not based in evidence and can be a little bit harmful. So I think parents and even autistic individuals themselves should pay attention to the websites that they're kind of exploring. I think looking for information that's based in lived experience is really important for folks, again, to develop that self-understanding, that sense of self-worth. And reputable sort of organizations like the American Academy of Pediatrics has some really great information on the internet. Locally, the Vermont Family Network is a great resource. And I would encourage all families to kind of access their pediatrician and their medical home for local resources as well.
Sure. And you've mentioned before that autism can look different from person to person, but do you recommend that maybe a family with a child that has autism or even somebody who has autism themselves reach out to other people?
I think that can be really helpful. Again, sort of building that sense of community and the fact that, hey, like I'm not alone in this can be, frankly, really life-saving for some individuals.
Absolutely. And I mentioned misconceptions a moment ago, so what does that usually look like? Yeah,
so I think there are a handful of misperceptions out there that deserve sort of attention. One, we've already kind of alluded to this, but the myth that people who are autistic don't desire relationships and don't demonstrate empathy. We know this is not true. There may be a small minority of folks who sort of fit that bill, but for the most part, people want to feel connected, they want to feel included, they want to feel belonged. And autistic individuals may demonstrate like heightened levels of empathy as well. So they may exhibit emotions in sort of a non-traditional way, but that doesn't necessarily mean that they're sort of emotionally empty. The second myth that comes to mind is that autism primarily occurs in boys. We've already kind of chatted about this, that we're learning more and more about how autism may present differently in girls. The third myth is that bad parenting causes autism, and that is just patently untrue. We know that parenting styles can affect a child's behavior, but doesn't contribute to the development of autism. And then I guess the last misperception is that, a lot of children and other autistic individuals exhibit repetitive motor movements that are often seen as bad. These movements may be disruptive for others, but they may be also really self-soothing for the individual who's exhibiting those movements. So we don't want to take them away necessarily. We don't want to punish individuals for demonstrating those movements because it actually may make them more anxious and more prone to feeling distress.
All right, thank you so much for joining us today. And that takes care of our program for today. I want to thank the crew behind the scenes here at WCAX for helping make our program possible. I'm Jolie Whitney. This is Across the Fence. Have a good one.